Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Tito Sumarwoto. I am mahasiswa MARS Universitas Muhammadiyah Yogyakarta. And also I am a doctor orthopedic and traumatology in Rumah Sakit Ortopedi Suharto Surakarta. In this time I would like to present my talking regarding with title Enhancing Safety of Orthopedic Surgery, the role of surgical safety checklist. So surgery is one of the most important healthcare in orthopedic, and as we know, orthopedic is focusing for the musculoskeletal problem and also injury. And since the surgical error can be happen and also intended and preventable, so we have to maintaining surgical safety that is have to paramount, and utilization of checklists ensure safety protocols by orthopedic teams. And WHO has already endorsed surgical safety measure that we call it surgical safety checklist in 2008. There are so many errors in orthopedic surgery, and as we know that frequently surgical errors in orthopedic is first is incompetent surgical team, especially for the doctor. So this is the most frequent orthopedic surgical error. And the second is inadequate preoperative planning. Since the planning for the surgery is not good, so there will become a surgical error. The next, not carrying out the standard surgical procedure. And then the next, the incorrect location and also incorrect patient. Since the surgery in orthopedic is very tough, and also so many patients that have to be operated in surgery, so there will be awareness among the surgical personnel. So there will be make a surgical error in orthopedic. And the next, the carelessness during surgical processes, and this condition they make surgical errors. And last but not least, improperly working medical equipment. As we know that the orthopedic surgery very dependent with medical equipment. So by improperly working medical equipment, there will be surgical errors in orthopedic. The most typical mistakes in orthopedic, one is eliminating an unfamiliar item. The second, by using wrong patient and for the wrong surgery. And the third, the improper surgical site, and also the improper surgical person. And the next is preventable injury during and also after the surgery. And the next, the anesthesia mistakes. As we know that surgery need to be anesthesia, so there will be mistakes anesthesia as well in orthopedic surgery. This is the surgical safety checklist. There are three distinct phases of the surgical procedures. First, we knew as sign-in, so before the patient is given anesthesia. And the second, before the surgeon makes the skin incisions, we call it time-out. And the third, before the patient leaves the operating theater or operating room, we call it sign-out. Yeah, so this is the surgical safety checklist that has already proposed by WHO in 2008. There are three distinct sections. The first, as we know, as I have mentioned before, the sign-in. This is the patient has comfort for identity, site, procedure, and consent. And also, we have already marked the site, and anesthesia safety check has already completed. And we put the pulse oximeter on the patient and function. And we have to know regarding for the allergy of the patient, and also the difficulty airway or aspiration risk, and the risk of loss of the blood more than 500 milliliters. So we do in the preoperative room. The second is before the skin incision, and we call it skin incision time out. So we have to confirm all the members of the team, introduce themselves, name and also enroll, and the surgeon, the anesthesia professional, and also the nurse verbally confirm the patient, the site and the procedure, and anticipated the critical events. Surgeon review what are the critical or unaffected steps, operative duration, and anticipated blood loss. And then the anesthesia team reviews, are there any patient-specific concern, and also the nursing team reviews. And as the antibiotic has already given to the patient, and essential imaging has already displayed. In the surgery of orthopedic, we have to know